So this is my proof of my audience, my 3 adults. Like that. And you're supposed to see most of my body.
You're all in there.
All right, perfect. All right, well, thank you guys so much for listening to my speech today. I'm Kiana. I am currently a nursing student at Aiken Technical College, and this is going to be an informative speech today about the career field that I'm going into, which is aesthetic nursing. I do currently work in it, but working towards my nurse practitioner to be able to provide services there, so very exciting. Again, this is for my Speech 205 class, and I'm going to be talking to you guys a little bit just about the world of aesthetics, what we do in practice there, some of the qualifications that you might need to get into it, and why I love it. All right, a little bit about patient care too, just a bit. So first off, Balthazar Gratian once said that a beautiful woman should break her mirror early. And I think that is so disheartening and so upsetting. But we do unfortunately live in a world that there is a huge emphasis on beauty and aesthetics and looking perfect all the time, which is unattainable and unachievable for most people, but it does also mean that a lot of people look in the mirror and just don't like what they see, and I am not willing to accept that. So that's why I love the aesthetic industry, because it gives us an avenue to empower people, to allow them to look into the mirror and say, I absolutely love what I see, and that is just the best feeling in the world. So that is why I've chosen aesthetics. So we get to switch the narrative. We get to make it so everybody believes that what they see and how they feel on the inside and how beautiful and amazing they feel on the inside is representative of their outside as well. So how do we do this? How does aesthetics work? So in aesthetics, there is kind of the more well-known things that you might know of, neuromodulators or Botox. You might have heard of that. Some fillers, you might have heard of that. But there's also a huge scope to the practice. There is things like regenerative therapies, there is vitamin replacements, there is a whole different world out there. So many providers will pick a niche or something that they specialize in. So if you love art, you are very artistic, you love facial balance and harmony, you might specialize in the fillers and the Botox, but you can also take a more holistic approach and do the regenerative stuff like platelet-rich plasma, which is a great regenerative therapy. You might do vitamin replacements. You can even specialize in things like hair loss and weight loss, medical weight loss, things that people struggle with. So there's also anti-aging. You can work in skincare. You can be the skincare specialist and the go-to person for anti-aging as terms of skincare, helping people fight cancer and help different things that might, prematurely age you. And so now that we've talked about kind of what aesthetics is and what are some things that you can do in there, the next thing I wanted to approach was the culture of it. So medicine in general, I know most of you guys have been to the doctor, I'm sure, and walking in you can feel a little bit plagued or nervous. You're like, I don't want to do this. And that is such a hard part for providers, I think, knowing that their patients are coming in just dreading the experience. But that is not our world that we live in. Every patient that comes through the door comes because they want to be there. They're excited, they're happy, they can't wait to talk to you, which makes for such a beautiful atmosphere to be in. It is a very spa-like experience. It's very luxurious. So that also transfers over to the staff and the morale. Everybody is happy, they're upbeat, and it makes a really, really great working environment. So it's a great way to introduce medicine in a way that makes people feel like it's a luxury and not a necessary evil. And as well as that, I also love that you can provide care in a way that is very empowering to people. So it is a way to take medicine and make it into something fun and to make it artistic and to make the world just a little bit more beautiful, so you're not sitting there and feeling like, ugh, I have to see 20 patients today and I'm just exhausted, I can't do it. But you get to be excited. Every single person, you are a part of their self-love journey, their self-care journey, and just overall empowerment and making people just feel on top of the world, which makes a very, very fulfilling experience as a provider. So I know a lot of providers that just love their jobs. Burnout is very, very low, turnover is very, very low, and a lot of providers say that they just never want to do anything else. All right, so now that we've discussed a little bit of what the industry has to offer, let's go into the qualifications of it, which is a little bit of a broad topic because state to state, your licensure and your scope of practice is different. So just across the border in Georgia, they say the medical board there and the nursing board says you can be an RN, which is a 2 to 4 year degree depending on how you go. You can inject dermal fillers, you can inject Botox. There's pretty much nothing that you can't do without autonomy as long as you have a medical director. In South Carolina, they say you have to have an advanced degree. You have to be an advanced practice RN, or you have to be a nurse practitioner or above. You can even go the medical route if you wanted to be an MD. But it is an advanced degree. You're going to be in school for at least 6 years or so to be able to practice here. So it's really important to know where you're practicing, what the qualifications are, and how long you're going to be in school, and also understand that you are going to be continuing your education all of the time. The industry is always changing, there's new things that come out all of the time, and you have to keep up with it. You've got to keep up with the changing technology. So you might have to, after school, go into a mentorship, an internship. You might have to do paid trainings with some of the masters in the industry. You are learning every day for the rest of your life, far, far beyond school. So that's a big thing to think about, just to make sure that you're willing to be a student for the rest of your life. And just to kind of wrap everything up, to conclude everything, so we've talked about a little bit what aesthetics is, that it's much broader than a lot of people think, that you can specialize in a bunch of different things in it, that the patient care is just above par, that all of the providers are very caring, it's a loving experience. Just wanted to kind of wrap it all up and bring it around to the fact that aesthetics is so much more, and beauty is so much more than skin deep. So that is the biggest part of that industry that I think people don't understand, and I want to make sure that I convey that it is all about empathy. It is about understanding your patient. You might see somebody who's just coming in for their normal 3-month anti-aging, or you might see somebody who struggled with addiction or lost a ton of weight and they're now struggling with their appearance, and they want somebody to listen to them and understand, hey, this is what I want to see when I look in the mirror, and how can I get there? So having very empathetic providers and people who are willing to listen to patient concerns and say, this is our treatment plan and I'm here with you for the long haul, very important as aesthetic providers. And that is why I choose this path. I absolutely love the industry. I think it is a beautiful way to provide medicine. And that is kind of all I have to say about it. Do you guys have any questions about aesthetics for me at all? Anything I didn't answer for you?
Can I ask a general question?
Yeah, absolutely.
What is the difference between Botox and fillers? Or are they the same thing, and Botox is just like Kleenex, like a brand name?
Yeah, great question. So they're two completely different things. So Botox is a neuromodulator. So what it's going to do is it's going to go in and it's going to actually stop this chemical that interacts and allows your muscles to move and contract. So it stops that contraction of the muscle, and that is how we get the relaxation of the muscles, and you can treat fine lines and wrinkles, things like that. Dermal filler is a little bit more permanent. It's going to last, 2 to 5 years, even on label they say 1, but it does last much longer. Where Botox, you kind of every 3 months or so, you're going to go in and continue to do that. But the fillers is where you're replacing lost structure. So it's going to be for things like bone structure, filling in some deeper lines that you can do. You can do it a little bit more subdermally, so a little bit closer to the surface of the skin. And it's going to treat your deeper wrinkles, and it's going to replace bone structure. So one is the structure, and one is just kind of stopping the aging and stopping the movement.
Okay, thank you very much.
Yeah, you're welcome. All right, well, thank you guys so much. I really appreciate it.
Good job.
Thank you. This is my proof of my.
Yay! Good
Okay.
job.
Thank you guys.